Hi everyone. This is Dr. Nayadong. Just coming to you with a brief introduction to stroke to enhance your reading and to help you as you build critical thinking. This is just a supplement for your reading materials. So stroke or CVA, which is cerebrovascular accident or stroke, is just when blood supply to a part of the brain has been interrupted. So when this blood supply in a certain part of the brain is interrupted, it prevents oxygen and it prevents nutrients, and brain cells start dying from that point. There are two major types of stroke that we'll look at here in this course. Will be ischemic stroke and hemorrhagic stroke. I'll start with ischemic stroke. Ischemic stroke is subdivided into thrombotic and embolic. Thrombotic just means that blood clot that has formed in the cerebral artery. So the blood clot has formed in the cerebral artery. Why embolic? The clot probably started somewhere and then traveled to the cerebral artery. So for embolic stroke, the origin of the clot is not in the artery, in the cerebral artery. It just started somewhere, maybe the heart, then it travels to the brain. Okay, so major difference: thrombotic and embolic. So again, two major types of stroke. Ischemic stroke is divided into thrombotic stroke and embolic stroke, and then we have hemorrhagic stroke. Okay, hemorrhagic stroke now is rupture of the blood vessel. Okay, the blood vessels in the brain. We know that the carotid artery carries blood to the brain, right? So there's been a rupture. And why would there be this rupture in blood vessels in the brain? Most likely because of hypertension, uncontrolled blood pressure. Therefore, uncontrolled blood pressure is a risk factor for hemorrhagic stroke. So if you're caring for a patient with hemorrhagic stroke, one of your top priorities will be to monitor and control the blood pressure. So controlling this blood pressure, you probably have a parameter that your physician will give you to control this blood pressure, because you don't want to overdrop the blood pressure because the patient can re-stroke with hemorrhagic stroke. And so you just stay within the confines of the parameter given to you by your physician. So again, two types of stroke: ischemic stroke and hemorrhagic stroke. And ischemic stroke is divided into two, which is embolic. Embolic means that there's been a clot that has been formed in the cerebral artery, and thrombotic, the clot started somewhere and then traveled to the cerebral artery. Okay, and is blocking the artery. So TIAs are transient ischemic attack. Okay, so a patient that will likely have ischemic stroke will probably have TIA. What are TIA? Brief focal deficit. So this will be your patients that they'll probably just lose consciousness for a very brief period of time, then they regain it back. So it's like the patient just passes out for like few seconds, then they come back to normalcy. So again, it's brief focal deficit for TIAs. These are mini strokes. Let me put it like that. TIAs are mini strokes. So patients that are having mini strokes will eventually have ischemic stroke. Okay, so risk factor for TIA is again let me not go into risk factors. I just want to, since it's a 5-minute video, I just want to just focus on what is stroke and types of stroke and what you should watch for. Okay, so again, stroke, cerebrovascular accident, temporal blockage in a part of the brain. Okay, not enough oxygen is going to a part of, there's been an interruption in a certain part of the brain is not receiving enough oxygen and enough nutrients, and when that happens, the brain cells, they start dying. Okay, two types of strokes: ischemic stroke, hemorrhagic stroke. Ischemic stroke again divided into thrombotic and embolic. The hemorrhagic stroke is when the blood vessel has completely ruptured. Okay, then I mentioned TIA, which is transient ischemic attack, and with multiple which is mini strokes. So a patient that will have mini strokes will eventually have ischemic stroke. So it's a risk factor for TIA is hypertension, and TIA increases the chance of ischemic stroke. So finally, let's look at a little bit of location. If a patient is having a blockage in the anterior part of the cerebral artery, then you see clinical manifestations will be like poor judgment, cognitive impairment. This will be your patients that are very confused. If the patient is having blockage anywhere around the posterior part of the artery, then they'll have visual disturbances. If you think of occipital lobe, the posterior part, they'll have visual disturbances. And then if the blockage is anywhere from the middle part of the artery, then these are your patients that have aphasia or no speech. They have difficulties with speech. So again, if a patient is already having hemorrhagic stroke, which is rupture in the blood vessels, that means that the patient will bleed, right? The patient is probably having bleeding issues. So with that patient, we don't want to give them any kind of blood thinners because they're already bleeding. Okay, so if a patient comes in with any signs of stroke, which in the next video I'll be talking about the signs of stroke, your first thing you want to do as a nurse is like, we need a CT, because you want to determine what kind of stroke it is to know what kind of treatment you want to give that patient. Okay, if it's a hemorrhagic stroke, then of course we know no blood thinners. If it's a ischemic stroke, they'll want to do a blood buster, and an example of a blood buster will be TPA. Okay, we have a time frame to give TPA, and I'm right at about 5 minutes. So I'll stop here and then we'll continue with the next video. Thank you.